What is coronavirus? Coronavirus are a long family of virus which may cause illness in animal or human. In humans, severe coronavirus are known to cause respiratory infection ranging from the common cold to most severe diseases such as Middle East respiratory syndrome and severe acute respiratory syndrome. The most recently discovered coronavirus causes coronavirus diseases Covid-19. What is Covid-19? Covid-19 is the infection disease caused by the most recently discovered coronavirus. This new virus and this were unknown before the outbreak began in Wuhan, China in December 2019.
Symptoms of COVID-19: running nose, dry cough, fever, muscle pain, chest pain, headache. Although COVID-19 spreads, people can catch COVID-19 from others who have the virus. The disease can spread from people to small droplets from the nose or mouth, which are spread when a people with COVID-19 cough or exhale.
How to minimize the spread of COVID-19? 1. Personal protective measures. Practice proper hand hygiene. Cut and sneeze into your elbow or a tissue. Throw it into a bin and wash your hands. Healthy people don't need to wear masks. Masks should be reserved for healthcare workers and those who care for ill persons at home.
2. Environmental measures. Frequently clean use surfaces, clothes, and objects. Minimize sharing objects. Ensure appropriate ventilation. 3. Social distancing measures. Standing 1 meter away from a visibly symptomatic person. Self-isolation of individuals with symptoms of a respiratory infection is one of the most important measures for reducing disease transmission and limiting the spread of the virus in the community during an epidemic. For travel advice or travel recommendations, refer to official government advice. From the survey results, COVID-19 states on 21 April 2020 in different countries can be ranked as follows. United States is the most confirmed case infected people, reaching 799,456 and death reaching 42,604, followed by Spain, Italy, Germany, United Kingdom, France respectively. For the number of cases of COVID-19 in Thailand, there are cases confirmed 2,811, recovered 2,108, and deaths 48. The total number of infected people around the world can be confirmed to 2,400,000 people and dead to 100,070 people.
How do the tests for coronavirus work? How current tests work? 1. A swab is taken of the inside of a person's nose or the back of their throat. The sample is then sent to a lab to test. 2. DNA of the virus is extracted and purified, and enzyme reverse transcript converts the RNA to DNA. 3. The DNA is mixed with primer section of DNA designed to bind to characteristic parts of the virus DNA repertory, heating, then cooling DNA with this primer and a DNA building enzyme make millions of copies of the virus. 4. Fluorescent dye molecules bind to the virus DNA as its copy. Binding make them give of the molecule which is used to confirm the presence of the virus in the sample. Positive and negative tests. The fluorescence increase as small copies of the virus DNA are produced. If it crosses a certain threshold, the test is positive. If the virus isn't present, no DNA copies are made and the threshold isn't reached. In this case, the test is negative. Future tests. The current tests are good for diagnosing an infection, but they can tell us if someone has it and then recover. Tests that look for antigen again, the virus can do this. Tests that look for protein on the surface of the virus are also in development. These tests are fastest but less accurate. Issue with testing. Reagent issue. High demand and issue with reagent have delayed testing in some countries. Time consuming. It takes a few hours to get results from the test, limiting how many tests can be done. False positive and negative. In some cases, simple degradation or contamination can affect the result.
How to protect yourself against COVID-19. Eat hot food and use a serving spoon. Wash your hands often with soap and water. Wear face masks in public. Do not share personal items. Exercise regularly and get enough sleep. If you have a fever, sore throat, or difficulty breathing, please see a doctor immediately. Make a difference during the COVID-19 pandemic. Protect yourself and others from COVID-19. Stay home. Maintain distance. Donate blood and plasma. Report fraudulent COVID-19 tests, vaccines, and treatments. Save PPE for those on the front lines. The general public should wear cloth face coverings. Reduce panic buying of food. Clean your hands often. How to wash your hands correctly. 1. Apply soap and wet your hands with clean water. Turn off tap. 2. Lather your hands with soap and scrub 20 seconds. 3. Wash between your fingers. 4. Wash between your thumbs. 5. Scrub the back of your hands. 6. Scrub wrists and forearms. Turn on tap and rinse with clean water. Turn off tap.
COVID-19 call center in Thailand รามาธิบดี Hospital 0209 27222 จุฬาภรณ์ Royal Academy call 06458622420 and 06458622421. The effect of COVID-19. COVID-19 triggered an economic crisis. The hospitality business has suffered. Seats in restaurants are empty, but online takeaway services are booming. The role of telemedicine. The healthcare sector is increasing for outpatient service. Government spending increased, resulting in physical and mental health, social equality, crime and suicide.